Leader of the third party.
Thank you, Honourable Speaker. Yesterday, my colleague asked the Minister of Mental Health and Addictions if she would resist pressure to bring back flawed legislation from last summer. What we need to see from this government is that it takes the steps that health experts, scientists, researchers, advocates, and their own provincial health officer have been calling for years in order to reduce the number of people dying from an illicit and toxic drug supply, decriminalize drug users, and ensure there is a regulated and accessible safe supply. In fact, the BC Centre for Disease Control released an evidence review that states, quote, detention-based services are contrary to best public health practices in BC. They do not address illicit drug toxicity that is driving deaths. There's a lack of evidence that they are effective. They may result in post-release harm, including death, and that involuntary hospitalization increases stigma and reduces the likelihood of people seeking health care. My question, Honourable Speaker, is to the Premier. What does he propose to address the significant concerns with involuntary care expressed by the Chief Coroner, the Representative for Children and Youth, the Union of BC Indian Chiefs, the First Nations Leadership Council, and the BC Centre for Disease Control?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. Thank you to the member for raising the question and reaffirming what we're all feeling. There's nothing more important than protecting children, particularly the loss of such young lives to the toxic drug supply on Vancouver Island these past few weeks. Just puts that much more importance on the work that we're doing to expand voluntary care for youth in mental health and addiction distress, and to work across the spectrum on decriminalization, on safe supply, on a historic expansion and historic investment on the part of the British Columbia taxpayer in mental health and addiction support. Almost 100 million of that going specifically toward children and youth. We're working across the spectrum, and when we revisit the lessons learned from Bill 22 and work, because we continue to hear parents say that stabilization care post after an overdose is an important consideration and one of the tools that we want to have available as a last resort. We will continue to reaffirm that it will not be a criminal issue. It will not be anything to do with the justice system. Stabilization care, when it comes back to this legislation, will remain part of the healthcare response to a tragedy that has affected young people in British Columbia.
Leader of the third party on a supplemental.
Thank you, Honourable Speaker, and thank you to the Minister for her response. Unfortunately, it's not just the tragic death of children, it's 6 British Columbians a day who are dying from a toxic drug supply. It's thousands of lives that have been lost. The Minister says that this bill will be coming back, but the BC Centre for Disease Control presents an evidence-based argument against involuntary care. They say, quote, there is little to no evidence to support compulsory treatment for substance use disorders in general and for youth in particular. Compulsory treatment is associated with relapse, higher levels of mental duress, homelessness, and overdose, according to the BC CDC. People, especially young Black, Indigenous, and people of color, are less likely to seek help when they need it following involuntary care. The trauma they endure in the healthcare system is significant, and involuntary care may perpetuate that. My question, Honourable Speaker, is to the Minister of Mental Health and Addictions. The Premier and now she have signalled that involuntary care is a priority for this government. How is the Minister planning to address the concerns described by the BC Centre for Disease Control And why doesn't she do what experts are asking for and immediately expand access to regulated safe supply in order to save lives?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. The work that British Columbia is doing to expand safe supply as a way to separate people from the toxic poison drug supply that is killing so many British Columbians tragically is continuing. It is leading the country, and we are working as hard as we can to continue to break new ground. The 400% increase in number of people that have been connected by their doctors or primary prescribers to connect people with safe supply over the last year is encouraging, and there is more to do. Let me be clear, though, about what was proposed in Bill 22 and some of the conversations that we will have across British Columbia before that legislation or some form of it is reintroduced. It is not the secure care that the opposition has been proposing and what exists in places like Alberta. It is not forced treatment. It does not involve the police. It is a stabilization post-youth overdose for a short period where there is an opportunity to connect young people after they have stabilized with an option for care. That was the proposal made by my friend and predecessor to this legislature last summer. It did not have the support of the opposition parties. And so our work right now is to build out voluntary care, which is badly needed in British Columbia. We have done a lot. There is more to do, and I look forward to the broad conversations that will inform next steps.